here the pectoralis major has been removed, right? So सबसे पहले you will be coming across with this fascia, right? This fascia, you see this white fascia covering this pectoralis minor muscle, and this fascia is called as a clavipectoral fascia, right? So when we are going to remove this pectoralis major muscle, the first structure which will come across, that is this fascia, white is fascia over there. This is called as the clavipectoral fascia, right? Its name is representing coming from the clavicle and running over the pectoral region, right? Number two, if we remove this fascia over there, you can see underlying this muscle, this triangular muscle, we have talked about it already, that is called as the pectoralis minor muscle, right? After the pectoralis minor muscle, there is small muscle under the cover of this clavicle, and that is called as the subclavius muscle, right? Other than these two muscles, here you can see the certain strips of these muscles, these strips, right? These slips, these are the slips of the serratus anterior muscle. We have talked about its insertion already. Can anybody tell me what is the insertion of the serratus
स्कैपुला
anterior?
के मीडियल स्कैपुला
Yes,
के मीडियल बॉर्डर पे अटैच
very good. That is along the whole length of the medial border of the costal surface of scapula. You have to mention the costal surface of scapula. ठीक है? Dorsal surface पे दूसरे muscle attach होते हैं. ठीक है बच्चे? Okay. Okay. After that, this serratus anterior muscle, serratus anterior muscle, you can see these muscles present in between these ribs, and these are called the intercostal muscles, right? So under the cover of the pectoralis major, when we cut the pectoralis major, remove the pectoralis major from here, we'll be coming across with the clavipectoral fascia, this fascia. Then we have got this pectoralis minor muscle, number one. Number two, we have got this subclavius muscle. Number three, there is strips of the origin of the serratus anterior muscle, and then these the intercostal muscles, right? Okay, and here you can see this bony prominence in this region, that is the coracoid process. And as you know that the coracoid process से कौन से muscle originate करते हैं जी? Can anybody tell me the name of the muscles getting origin from the coracoid process?
Coracobrachialis or short head of bicep.
Very good. Coracobrachialis and the short. So here you can see from the tip of the coracoid process, these two muscles are coming. So they are also, you know, their origins is basically coming from the coracoid process. So these are also assumed to be the under the cover of that one. And then they और bones कौन सी इसके अंदर नजर आएंगे जी? कौन सी bones नजर आ रही हैं? That is the half of this sternum, then the costal cartilages and the ribs. These are also the under the cover of the pectoralis major muscle, right? And then here you can see these vessels coming down over here. ये कौन सी vessels आ रही हैं जी? Which are coming passing the cervicoaxillary canal behind the clavicle and passing into the axilla. These are the axillary vessels. Here you can see the axillary vein and the axillary artery in this region, right? So these vessels, and of course along with these vessels, और कौन सा structure pass करता है neck में से axilla में बेटा? Name the other structure passing from the
nerve.
Supraclavicular nerve.
No.
Sir, question repeat कर दे.
Deep to the clavicle, which nerves passes along with the axillary vessels? कौन सा plexus होता है बेटे जो axillary vessel के साथ आता है?
Brachial plexus.
Brachial plexus, right? So brachial plexus, the cords of the brachial plexus and its branches, ठीक है? Cords of the brachial plexus and its branches. So all these structures are where they are present under the cover of the pectoralis major muscle. So there are a lot of structures. Okay, we have talked about already the certain muscles. We are left with only serratus anterior muscle. Okay, we'll talk about it in a few minutes. First of all, we'll talk about this fascia that is called as a clavipectoral fascia. यहाँ तो कोई problem तो नहीं है बच्चे? Understand the structures which are present under the cover of the pectoralis major muscle. जी सबको समझ में आ गया जी? पेक्टोरलिस मेजर के कवर में कौन कौन से मसल्स होते हैं बेटा? हेलो
यस सर, आ गया समझ.
बोल कोई भी नहीं रहा. ओके, we'll talk about the clavipectoral fascia जी. ठीक है जी? This white sheet of this fiber sheet. Well, this clavipectoral fascia is also called as the costocoracoid membrane, right? Costocoracoid. Costo means coming from the costal, cartilages. Here costal surface से आ रहा है और ये coracoid membrane की तरफ जा रहा है, right? It's called as the costocoracoid membrane, also the coracoclavicular. ठीक है? Coracoclavicular fascia इसको कहते हैं. Well, what is the definition? It is a strong fibrous sheet which is situated deep to the clavicular part of the pectoralis major muscle. ठीक है? He is a strong fibrous sheet which is present deep to the clavicular part of the pectoralis major muscle. ठीक है? It extends from here like this. ठीक है? Here like this one, this whole sheet, right? Okay. So it extends from the clavicle above up to the axillary fascia below. ठीक है? ये ऊपर से clavicle से extend करता है and इसकी जो lower limit है that is a this is a dome of the axillary fascia. So it's coming to the dome of the axillary fascia. Clear जी? Extension पता चल गया जी? It's a strong fibrous sheet, right? It's a strong fibrous sheet that is situated below the clavicular head of the pectoralis major muscle. ठीक है? यहाँ पे clavicular head, कहाँ पे है clavicular head pectoralis major का? This one, on the anterior surface of the medial 2/3 of the clavicle. Anterior surface of the medial 2/3 of the clavicle, right? So it is extending from here down to from the clavicle down to the axillary fascia. Is it clear जी? ठीक है बच्चे, की प्रॉब्लम तो नहीं है. And here you can see that it is going to occupy the interval. It is going to occupy the interval between the subclavius and the pectoralis minor. ये देखिए, this pectoralis minor and subclavius के दरमियान का जो है एरिया, ये इसको भी कवर कर रहा है, right? And इसका फंक्शन क्या है बेटे? Basically is going to protect these axillary vessels. देखें axillary vessels को इसने envelop किया हुआ, right? Enclose किया हुआ. So it is also going to enclose or protect these axillary vessels. Now we'll talk about the upper aspect of this clavipectoral fascia. Okay, for this I just want to show you another picture. Okay, here you can see okay जी, here you can see again, this is the clavipectoral fascia, right? ठीक है जी, coming from the clavicle going towards the axilla. ठीक है, axillary fascia, right? Okay, now here you see this is a section, vertical section, right? And here you can see this is a clavipectoral fascia, right? This clavipectoral fascia, and I told you that it is going to cover the interval between the pectoralis minor and the subclavius, right? Now on the upper aspect, it is going to split. Here you can see it is going to split into the anterior lamina and the posterior lamina, and it is going to enclose a muscle that is a subclavius muscle. ठीक है बेटा? You see that this clavipectoral fascia in its upper aspect, it is going to. Furqan want to ask something? Okay, so clavipectoral fascia, it splits into the two parts and it is going to enclose a muscle, subclavius muscle. Its anterior lamina is attached to the anterior lip of the subclavian groove and the posterior lamina is attached to the posterior lip of the subclavian groove. प्रॉब्लम तो नहीं जी यहाँ तक अटैचमेंट पे? अपर पार्ट में की प्रॉब्लम, राइट? ठीक है? And here you can see it is going to split over here and enclosing this muscle and is attached to the margins of the, मैंने आपको बताया था ना कि it is attached to the margins of the subclavian groove, and its posterior lamina it is going to fuse with this fascia. ये कौन सा fascia आ रहा है जी ऊपर से? नेक्स्ट से कौन सा fascia आ रहा है?
Latissimus.
हाँ, कौन सा fascia होता है नेक में? Deep cervical fascia, right? This is a deep cervical fascia, I told you before. ठीक है? Platysma तो ऊपर से remove हो गया ना? We have removed the platysma is a superficial muscle. हमने इसे काट दिया, हमने pectoralis major को भी काट दिया. तो नीचे क्या आ जाएगा? Deep fascia. Superficial fascia के नीचे क्या होता है? Deep fascia. So deep fascia of the neck is called as the deep cervical fascia. ठीक है? So this posterior lamina of this clavipectoral fascia is going to fuse with the deep fascia of the neck. ठीक है? Deep cervical fascia से भी कर रहा है. And it is also going to fuse with the fascia around the axillary vessels. ठीक है जी? Axillary vessels के भी गिर्द बेटे इसकी अपनी एक fascial sleeve होती है, right? And it is going to be fused with that one. मैं अभी आपको दिखाता हूँ. Okay, this is also a section you can see here. This is the clavipectoral fascia. This one, ठीक है? ये इसके pectoralis minor है नीचे और ये इसने subclavius को enclose किया हुआ है. And here it is going to be fused with the using the anterior, this is anterior aspect of the subclavian groove, is a posterior aspect. और ये posterior aspect से ये जो आ रहा है, इसकी जो sheath आ रही है, is going to fuse with the, you see, behind the clavicle, it is going to fuse with the, this is the deep cervical fascia, right? And here you can see that these are the axillary vessels. For axillary vessels, they are also having a fascia around them. That is called as the axillary sheath. And here, this posterior lamina, it is also going to fuse with the axillary sheath. Is it clear, Ji? Is it clear? The posterior lamina, you see, this is the clavipectoral fascia divides into the anterior lamina going towards the anterior lip of the subclavian groove, and this is the posterior lamina going towards the posterior lip of the subclavian groove. And this posterior lamina is going to fuse with the here with the axillary sheath. Axillary sheath is in a fibrous sheath which is just going to enclose the axillary vessels together, right? And from here, this posterior lamina is also going to fuse with the deep cervical fascia. Is it clear, Ji? You can see the cervical fascia over here. Clear? Any problem, bache? Okay, I just show you what's the axillary sheath. Hello?
जी सर.
बेटे कोई प्रॉब्लम है तो मुझसे पूछ लें, ठीक है?
No sir.
Clear है ना? Here you can see the axillary sheath, beta, in this picture, and this axillary sheath is a extension of the prevertebral fascia. ये एक fascia आ रहा है, it's a deep fascia, ठीक है? Deep fascia of the neck basically also, which is just going to enclose the muscles around the vertebral column. ठीक है? ये vertebral column है ना, इसके साथ जो muscles होते हैं बेटे, इसको इस fascia ने enclose किया होता है. ठीक है? This is called the prevertebral fascia. ठीक है? जो prevertebral muscles हैं, ये उसने उसको envelop किया, right? तो इस deep fascia से prevertebral fascia से एक sleeve आती है extension की, जो कि ये देखें ये vessels को यहाँ से enclose कर रही है, और enclosing these vessels, and these are the axillary vessels. ठीक है? इनको enclose कर रही है, and it is just going passing behind the clavicle and going into the axilla. ठीक है? This is an axillary sheath. और clavipectoral fascia क्योंकि यहाँ पे attached है, तो it is also attached with this fascia, axillary fascia. Is it clear, beta? Sorry, axillary sheath. ठीक है जी? Okay. So again, in the upper aspect, it is going to split into the two lamina, anterior and posterior, which is just going to enclose a muscle that is the subclavius muscle and is attached along the margins of the subclavian groove. ठीक है? Okay जी. Now, the medial aspect. Medially, here you can see this fascia. This fascia. Medially, it is going to fuse with the fascia covering the first and the second intercostal spaces. You see, the first and the second intercostal space के ऊपर जो fascia है, ये इसके साथ आके, it is going to blend. This fascia is going to blend with the fascia present over the first and the second intercostal space. ठीक है जी? Is it clear? And here it is attached. Someone is saying something. कौन है जी? मोहम्मद कासिम. एक्सिलरी शीथ को रिपीट कर दें. ओके बेटे आप माइक पे क्वेश्चन कर लें, ठीक है? ओके. एक्सिलरी शीथ बेटा मैंने आपको बताया, एक्सिलरी शीथ इट इज द एक्सटेंशन ऑफ द अनदर फेशिया इन द नेक. ठीक है? अब फिलहाल इतना याद रखिए, जब नेक पढ़ेंगे ना उसमें विल टॉक अबाउट इन डिटेल. ठीक है? ये ठीक है. एक्सिलरी शीथ इज बेसिकली द एक्सटेंशन ऑफ अनदर फेशिया कमिंग फ्रॉम द नेक. एक तो ने पढ़ा डीप सर्वाइकल फेशिया, दैट इज द फेशिया जस्ट गोइंग टू एनक्लोज द होल ऑफ द नेक. ठीक है? उसके बाद फिर नीचे मसल्स हैं, राइट? ये जो another fascia है ना, ये that is the prevertebral fascia of the neck. This prevertebral fascia basically बेटे जो है ना cervical fascia जो है ना, हम इसको four parts में divide करते हैं. ठीक है? The investing layer of deep cervical fascia जो कि पूरी neck पे enclose कर रहा है. उसके बाद एक होता है the pretracheal fascia जो कि आपके trachea और उसके साथ जो gland है उनको enclose कर रहा है separately, right? उसके बाद एक होता है कैरोटिड शीथ, जो कि आपकी ये देखें, ये आपकी कैरोटिड वेसल जो ऊपर जा रही है, ये इनको एनक्लोज कर रहा होता है, ठीक है। और एक द फोर्थ वन इज द प्री वर्टिब्रल फेशिया, जो कि आपके मसल्स अराउंड द वर्टिब्रल कॉलम, जो नेक आपका वर्टिब्रल कॉलम है ना, ये सर्वाइकल वर्टिब्री, इसके इर्द गिर्द जो मसल्स है उनको एनक्लोज कर रहा होता है, दैट इज द प्री वर्टिब्रल फेशिया। सो दिस एक्सिलरी शीथ इज अ एक्सटेंशन कमिंग फ्रॉम द प्री वर्टिब्रल फेशिया। अब समझ में आ गया कासिम बच्चे? ठीक है, प्रॉब्लम है तो बेटे भी पूछ लो। अच्छा नो माइको, ठीक है, आ गया समझ? एक्सिलरी शीथ कहां से आती है? एक्सिलरी शीथ इज बेसिकली इट इज अ एक्सटेंशन ऑफ द प्री वर्टिब्रल फेशिया, ठीक है जी। Okay, now we'll move towards our topic again. Here we are talking about the attachments, ठीक है जी, attachments. So on the medial aspect, spirally मैंने आपको बता दिया कि spirally it is going to be attached where with the marginal subclavian groove and is going to blend with the deep cervical fascia. Medially it is going to blend with the fascia covering the intercostal first and the second intercostal space, ठीक है। ये fascia आके ये blend कर जाता है with the fascia covering the first and second intercostal space and it is attached over the first rib, ठीक है। ये फर्स्ट रिब से अटैच होता है, कहां पे? जस्ट मीडियल टू द ओरिजिन ऑफ द दिस सबक्लेवियस मसल। सबक्लेवियस मसल की ओरिजिन के मीडियल एस्पेक्ट पे इट इज अटैच्ड विद द फर्स्ट रिब। किसी को पता है जी व्हाट इज द ओरिजिन ऑफ द सबक्लेवियस मसल? जी कोई मुझे बताएगा?
सर यही फर्स्ट कोस्टल कार्टिलेज जो होती है वहां से होती है इसकी ओरिजिन।
इट इज गेटिंग ओरिजिन फ्रॉम द फर्स्ट रिब नियर द कोस्टोकॉन्ड्रल जंक्शन, जहां पे आपका रिब इज गोइंग टू मेक ए जॉइंट विद द कार्टिलेज, कोस्टल कार्टिलेज, ठीक है। तो यहां से ये देखिए मसल ओरिजिनेट कर रहा है, ये रिब आ रही है राइट, और ये इसका कार्टिलेज है, ये दिस इज द कोस्टोकॉन्ड्रल जंक्शन, और यहां से ये मसल ओरिजिनेट कर रहा है। सो दिस फेशिया इज गोइंग टू बी अटैच्ड विद द फर्स्ट रिब और जस्ट मीडियल टू द ओरिजिन ऑफ दिस सबक्लेवियस मसल। कोई प्रॉब्लम तो नहीं जी मीडियल अटैचमेंट्स के ऊपर? मीडियली दो चीजें हैं जी, number one it is going to blend with the fascia of the first and second intercostal space, and secondly it is attached with the first rib medial to the origin of the subclavius muscle, ठीक है जी, clear? Now we move to the lateral aspect. On the lateral aspect here you can see it is getting thicker, ठीक है, it's getting thicker and it is going to be attached with the coracoid process. Okay, just show you somewhere else. Okay. Okay, you can see this is a pectoral fascia, and on the lateral aspect it is going to be thick, dense, and it is whitish, ठीक है, जितना होगा, and it is going to be attached with this coracoid process, ठीक है, and this thickened portion is called as a costocoracoid ligament, right, coming from the costal cartilage and is going to be attached to the coracoid process, right. So this lateral attachment that is called as the costocoracoid ligament, ठीक है जी, कोई प्रॉब्लम तो नहीं है बच्चे? In the lower aspect, ठीक है, in the lower aspect, now not traveling towards this axilla, right, in the lower aspect it is thin, right, and when it reach at the upper border of the pectoralis minor it is going to split again into two and it is going to enclose this pectoralis minor, ठीक है जी, समझ में आ रहा है बच्चे? कोई प्रॉब्लम हो तो मुझसे पूछ लीजिएगा, राइट। इन दी लोअर पार्ट, ये तो अपर अटैचमेंट है जी, ये लेटरल अटैचमेंट हो गई, ये मीडियल अटैचमेंट हो गई। नाउ द लोअर पार्ट लाइक दिस वन टुवर्ड दिस वन, राइट, in the lower part it is thinner and when it will reach at the upper border of pectoralis minor it is going to split into the two and is going to enclose this pectoralis minor muscle, and at the lower border of pectoralis minor it is going to continuous with the dome of the axillary fascia, ठीक है, this is the dome of the axillary fascia, यहाँ पे आके attach हो जाएगा, right, and due to this attachment it is going to pull this axillary fascia towards upwards, ठीक है, ये अपवर्ड पुल इसको करता है। ओके, जस्ट शो यू वन समवेयर एल्स। ओके, here you can see the fascia coming down and closing the pectoralis minor muscle, and then it is going to be attached with the dome of the axillary sheath, and this upward dome pull is basically provided by this part of the clavipectoral fascia that is called as a suspensory ligament of the axilla. So the part between the axillary fascia and the pectoralis minor that is also called as a suspensory ligament of the axilla. ठीक है बेटा, कोई प्रॉब्लम? लोअर अटैचमेंट पता चल गई जी?
यस सर, पता चल गई।
अच्छा वो अभी आगे आएगा जी कासिम, मैं भी ये बताता हूँ. Okay. Okay जी. Now, what are the structures which are passing through the clavipectoral fascia? ठीक है? Clavipectoral fascia में से कौन से structures pass कर रहे हैं? बेटा इसमें दो structures they are getting inside, superficial से deep जा रहे हैं, और there are certain structures that are coming outside from the deeper aspect to the under the cover of pectoralis measurements, right? So the structure piercing. So the structure which are entering from the superficial to deep, number one. Thus you can see this from the phallic vein. This phallic vein, it is running in the deltopectoral groove, and then it passes, pierces through this clavipectoral fascia and is going to enter into the this. You can see vein are axillary vein. So phallic vein is going to pierce through the clavipectoral fascia and is going to enter into the axillary vein. Number one. Number two, the superficial lymphatics from the breast and the pectoral region, they are going to pierce through this clavipectoral fascia and goes towards the apical group of the axillary lymph nodes. ठीक है? Axillary group of the lymph nodes in the apex of the axilla. There are the collection of the lymph nodes over there. So ये lymphatics, they are traveling from the superficial aspect of the breast and the pectoral region and going deeper toward the to enter into the apical group of the axillary lymph nodes. And the two structures which are coming out here, you can see this nerve coming out of this one, and this is called the lateral pectoral nerve. ठीक है जी? Lateral pectoral nerve, it is the branch of the brachial plexus, lateral cord of brachial plexus, well, and it is going to supply which muscle जी? मैंने बताया था जी. Lateral pectoral nerve किस मसल को supply करेगी? यहाँ से बाहर आएगी तो यहाँ पे ऊपर कौन सा मसल पड़ा है?
Pectoralis major.
Right. So you see, it's coming out of here from here and is going to enter in the deep surface of pectoralis major and is going to supply that muscle, right? And the vessels coming out over here, these are called the thoracoacromial vessels. Okay? So these thoracoacromial vessels, these are the branch. It's a branch of the first part of the axillary artery, thoracoacromial vessel. Okay, ji. It's coming from the axillary artery. कोई problem तो नहीं है बच्चे? So there are four structures which pierces through the clavipectoral fascia. Number one, cephalic vein. Number two, एक nerve है जी, lateral pectoral nerve. Then the thoracoacromial vessels. And number four, we have got the lymphatics. Is it clear? Well, we are just left with the one muscle in this region, and that is called as a serratus anterior muscle. And as I told you before, the serratus anterior muscle, that is okay, the serratus anterior muscle. The serratus anterior muscle, I told you that this muscle, it is getting origin from the outer surfaces of the upper 8 ribs. ठीक है जी? Outer surfaces of the upper 8 ribs by the 8 or 9 digitations. ठीक है? Sometimes जो second rib से digitations आती हैं, वहाँ से 2 digitations होती हैं, right? From the second rib, normally the 2 digitations arises. So it is getting origin from the 8 or the 9 digitations from the outer surfaces of the upper 8 ribs. ठीक है? ये इसकी origin है, and it is these are getting origin. You can see in the mid axillary planes, yeah, right, from here, in the mid axillary plane, and it is going to be inserted where जी? कहाँ पे insert होता है जी? I told you.
Medial border of scapula पे.
Okay. You can see it is attached where? Along the whole length of the costal surface of the medial border of the scapula and the inferior angle. ठीक है? Is it clear? It just starts from the superior angle, and you see I told you it has got the 8 digitations, right? So the first digitation is going to be inserted from the superior angle to over here in this region up to this, roughly up to the spinal region of the spine, up to spine, after superior angle to spine, and the remaining medial border is receiving the insertion of the 2 digitations, and the remaining 5 digitations, they are going to be inserted where? At the inferior angle, right? So this is the distribution of these 8 digitations, that how they are going to be inserted along the whole length of the costal surface of the medial border of the scapula. Our first digitation from the superior angle to the spine, and then the remaining border, medial border, receiving the insertion of only 2 digitations, second and third, and the remaining 5, they are going to be inserted in the inferior angle. Is it clear, Ji? Okay. Now, what is a nerve supply? I told you that its nerve supply is derived from the nerve that is called as a long thoracic nerve. Okay, Ji? And long thoracic nerve, it is a branch coming from the brachial plexus, from the roots of the brachial plexus. इसकी जो root value है बेटे, that is the C5, C6 and C7. C5, 6, 7. ठीक है जी? इसकी root value is C5, C6 and C7. If I do have, I just show you. चलो मैं अभी आपको दिखा देता हूँ अगर मेरे पास हो तो. Okay जी. Have a look over this. This is the brachial plexus. ठीक है? This is the brachial plexus. And here, this is a long thoracic nerve coming down from the C5, C6 and C7. You see? C5, C6, C5. This is a long thoracic nerve coming down. C5 से C6 और C7 से ये आ रही है आपकी long thoracic nerve. Right? You see this one. This long thoracic nerve. Right? It's coming from the roots of C5, C6 and C7. And this is going to supply the muscle that is called the status anterior muscle. And then what would be the action of the status anterior, जी?
फॉरवर्ड मूवमेंट करवाता है स्कैपुला की.
कैसे?
ये नहीं पता सर.
अच्छा जी, नहीं पता. ओके, जस्ट चलिए बेटे. ओके. अच्छा, अब ये देखें, right? This is the muscle which is coming. This muscle is coming from the anterior aspect, running along the lateral aspect of your chest wall, and is going to be inserted over the medial border of the scapula. यहाँ पे right? अब जब ये contact करेगा तो क्या करेगा? It will draw the scapula forwards. ठीक है? ये scapula को आगे की तरफ खींचेगा. ऐसे ही है जी? ठीक है? जब ये muscle contact करेगा तो it will pull that scapula forwards around the chest wall. ठीक है? चेस्ट वॉल के ऊपर इसको इस तरह ये इसको पुल करेगा फॉरवर्ड्स. ठीक है? जब ये पुल करेगा तो ये क्या करेगा? इट विल हेल्प इन विच मूवमेंट? इन द प्रोट्रैक्शन ऑफ द अपर लिम्ब. ठीक है? व्हाट इज मीन प्रोट्रैक्शन? किसी को पता है प्रोट्रैक्शन क्या होती है? पढ़ाई थी जी जब पोजीशंस पढ़ाई थी. इट्स द एक्शन ऑफ extending the any part of the body when you are going to protect something, when you are going to push the pushing and the punching movement.
सर टंग में पढ़ा था शायद.
अच्छा चले. So well, whatever. So it's an action of extending any part of body. So when you are just going to push something, or when you are going to have the movement like punching movements, जो punch करते हैं, so this is called the protracted movement, right? So this protraction movement is basically contributed by that scapula. Number one. Number two, when this inferior fibers, जब ये inferior fibers contact करेंगे तो क्या करेगा? It will pull the inferior angle forwards. ठीक है? और उसको जिस तरह रोटेट करेगा. जब ये फाइबर्स ये नीचे से आ रहे हैं ना फाइबर्स, ठीक है? ये कमिंग फ्रॉम ये ओब्लिक फाइबर्स आ रहे हैं ना फ्रॉम दी. मैंने आपको बताया कि 5 डिजिटेशंस के फाइबर्स इंफीरियर एंगल पे आ रहे हैं लाइक दिस. ये ओब्लिकली आ रहे हैं फाइबर्स इस तरह, राइट? तो जब ये कॉन्टैक्ट करेंगे तो क्या करेंगे? दे विल पुल इट फॉरवर्ड एंड रोटेट इट अपवर्ड्स. ठीक है? ये इसको ऐसे रोटेट करेगा. सॉरी इट्स जस्ट लाइक पुल लाइक दिस, राइट? ये इस तरह जब ये सॉरी इससे रोटेट करेगा, राइट? जब इसको जब ये यहां से फाइबर्स को पुल करेंगे इस तरह, ठीक है? तो क्या होगा कि आपकी जो स्कैपुला ये जो ग्लिनोइड प्रोसेस है इट विल बी टर्निंग अपवर्ड्स. ठीक है? ये ऊपर की तरफ जाएगा. ठीक है? when this fibers will contract, it pull it forward. ठीक है? इसको जब या फॉरवर्ड की तरफ पुल करेगा तो आपकी स्कैपुला रोटेट करेगी तो आपका ये जो ग्लिनोइड कैविटी है इट विल बी टर्निंग, इट विल बी फेसिंग अपवर्ड्स. ये लेटरली प्लेस्ड है ना. जब ये इंफीरियर एंगल को आगे पुल करेगा तो क्या होगा? ये इट विल टर्न अपवर्ड्स. ठीक है? ये इस तरह ऊपर की तरफ इसका चला जाएगा. सो इट इज गोइंग टू हेल्प इन द एबडक्शन ऑफ द शोल्डर. ठीक है? आपको जो आर्म की एबडक्शन होती है ना शोल्डर जॉइंट के ऊपर, तो उसमें when you raise your hand, if you can feel कि जब आप अपना ये आर्म को एबडक्ट करते हैं, ठीक है, तो इट राइजेस अप टू द 90